10 exercises that destroy your knees and spine after 40. Unfortunately, due to lack of proper guidance, many people end up repeating movements daily that seem harmless, but are wrecking knees and compressing vertebrae day after day. And the worst part, discomfort in the knees and spine starts with small symptoms. A pop here, a twinge there. Over time, the consequences tighten and limit your training, and even simple daily activities begin to suffer because of it. And no, this has nothing to do with age or a weak body. The problem is precisely certain exercises that overload tendons, ligaments, and joints, which naturally lose some resistance as the years go by. That's why today you'll see 10 exercises that most destroy your knees and spine after age 40, and I'll also give you smarter alternatives to replace each one and avoid injuries. Stay attentive until the end because exercise number 4 is the most damaging of all. Before we begin, understand something fundamental. I'm not saying if you're over 40 and do these exercises, you'll definitely get injured. I'm just saying they represent a greater risk due to the natural changes that occur in our bodies over time. Exercise number 10, leg press. At first glance, the leg press seems simple and easy. You lean back, adjust your body, position your legs, push up and down, and done. But that's exactly where the danger lies. When you put excessive weight on the leg press, your knees are exposed to enormous compression force, especially when you lower the seat too much, bringing your knees close to your chest. In this position, the pressure on the patellofemoral joint, that junction between the patella and femur, increases drastically. Additionally, many people tend to lock their knees when fully extending their legs, which transfers all the load to the ligaments and tendons instead of keeping the muscles engaged. You should know that after 40, our ligaments no longer have the same elasticity as in youth, and this type of pressure can lead to injuries like anterior cruciate ligament or meniscus tears. For your spine, the problem is even worse. When you lower the weight too much, the lumbar region tends to detach from the backrest, creating excessive curvature that compresses the intervertebral discs. A much safer alternative for the quadriceps is the hack squat, where you keep your back supported and feet more forward, drastically reducing pressure on the knees. The working angle is more natural and you can better control the depth of movement without having to go down so much that it compromises the lumbar position. Exercise 9, traditional crunches. Moving on to the second problematic exercise, traditional crunches. The one everyone does, lying on the floor with hands behind the neck, repeatedly raising and lowering the trunk. Seems harmless, doesn't it? But this repetitive movement puts enormous pressure on the discs of the lumbar spine. Each time you flex your trunk upward, you're compressing the intervertebral discs unevenly, pushing them backward. Over time, this constant pressure can lead to herniated discs, especially after 40, when natural dehydration of the discs has already begun to occur. Another serious problem is that many people pull on their neck with their hands when doing the movement, transferring tension to the cervical spine and potentially causing injuries to the vertebrae in the neck. And there's more. Traditional crunches primarily work the rectus abdominis, that six-pack, but do little for the deep core muscles, which are truly responsible for spine stability. Therefore, a much more efficient and safe alternative is the plank. It engages all core muscles simultaneously, including the transverse and oblique muscles, without putting excessive pressure on the spine. Exercise 8. Bench press with free barbell. Classic, traditional, the favorite of many people in the gym. But is it really friendly for those over 40? The main problem with the free barbell bench press is the lack of natural joint movement. The bar forces your arms to follow a fixed path, which doesn't always respect the individual anatomical structure of your shoulders. As the years go by, our tendons and ligaments lose elasticity, and forcing the shoulders to follow a rigid pattern of movement can lead to rotator cuff injuries, which is naturally more fragile after 40. Additionally, the bench press puts significant load on the shoulder joint when the elbows are below the chest line, creating torque that can cause inflammation and wear. For the spine, the problem comes when we excessively arch our backs, trying to lift more weight, which compresses the lumbar vertebrae and can aggravate existing problems. A much safer alternative is the dumbbell bench press. With dumbbells, each arm works independently, allowing your shoulders to follow their natural pattern of movement. You can adjust the angle of wrists and elbows to find the most comfortable position for your joints. Additionally, you can better control the range of motion, avoiding lowering your arms too much and compromising your shoulders. Exercise 7. Dumbbell flies. This one injures beautifully. At first glance, it seems like a simple movement to isolate the chest. Lie on the bench, open your arms with dumbbells, and then close them over the chest. But this movement puts the shoulders in an extremely vulnerable position. When you open your arms laterally with weight, you create a huge lever that pulls directly on the glenohumeral joint, the junction between the humerus and scapula. This position stretches the shoulder ligaments and tendons to their maximum, particularly when the elbows are extended. The problem is aggravated because many people tend to lower the dumbbells well below the chest line, further increasing tension in the joint capsule and rotator cuff. Over time, this can lead to shoulder instabilities and chronic tendinitis, painful conditions that are difficult to recover from, especially after 40, when tissue regeneration is naturally slower. For the spine, the risk comes from the tendency to arch the back during exertion, especially when the weight is too heavy, misaligning the lumbar vertebrae. A much safer alternative is cable or machine flies. With cables, you can maintain constant tension on the chest without putting the shoulders in that extreme stretch position. The movement path is more controlled, and you can perfectly adjust the angle to respect your joint limits. Exercise 6. Behind the neck press with barbell. This exercise was once very popular in old gyms, but today, we know it represents one of the greatest risks to shoulder health. When you lower the bar behind your head, your shoulders are forced into extreme external rotation combined with abduction. Basically, you're putting your joint at the limit of its natural range of motion. This position compresses the subacromial space, where important tendons like the supraspinatus, part of the rotator cuff, pass through. Over time, this repetitive friction can cause impingement syndrome, a painful condition where tendons become inflamed and worn. To make matters worse, the position of the bar behind the head requires excessive extension of the cervical spine, overloading the vertebrae in the neck. And if you don't have good shoulder mobility, something common after 40, you'll tend to compensate even more with your spine, increasing the risks. A much safer alternative is the front dumbbell press. In this exercise, you lift the dumbbells from shoulder height, in a movement that much better respects the natural mechanics of the joint. You can adjust the angle of your hands and arms to find the most comfortable position without forcing sensitive structures. Before we continue, don't forget to subscribe to the channel. Having constant access to science-based information is what will help you progress with health in the long term in the world of bodybuilding. Exercise 5. Dumbbell front raises. This simple movement, when done incorrectly or with excessive weight, can be devastating for the shoulders. The main problem lies in the pure frontal elevation mechanism, which isolates the anterior deltoid too much, creating an imbalance with the other portions of the shoulder. This muscle imbalance, over time, can alter the biomechanics of the glenohumeral joint, leading to instabilities and possible injuries. Additionally, when you raise your arms in front with weight, the biceps tendon is subjected to great tension, potentially causing painful tendinitis. Another critical point is that many people end up using body momentum to lift heavier weights, transferring tension to the lumbar and cervical regions of the spine. The repetition of this movement pattern with overload can compromise the intervertebral discs and paravertebral musculature. I honestly wouldn't even worry about a substitute for dumbbell front raises, as you'll already activate your anterior deltoid plenty when training chest, and you'll already have shoulder development in your workout, already providing more than enough stimuli for anterior deltoid development, making dumbbell front raises therefore dispensable. Exercise 4. Diamond push-ups. You've probably seen it. It's that push-up where you position your hands close to each other, forming a diamond with your index fingers and thumbs. It's excellent for working the triceps, no denying that. However, there's also no denying the extreme pressure on wrists and elbows. The hand position forces the wrists into an unnatural angle, compressing the median nerve and increasing the risk of developing problems like carpal tunnel syndrome. For the elbows, the stress is no less. The closed angle between the arms drastically increases the compressive force on the joint, potentially leading to epicondylitis, also known as tennis elbow, or even bursitis. And it doesn't stop there. The diamond position also forces your shoulders to rotate internally excessively, putting the rotator cuff tendons at risk. To work the triceps, you have thousands of better options. One of them is the triceps pushdown with rope. This exercise allows you to work the triceps with similar intensity, but without placing your joints in extreme positions. You can perfectly adjust the height of the pulley and body position to find the most comfortable angle for your elbows and shoulders. The rope allows natural rotation of the wrists during the movement, drastically reducing stress on these joints. Additionally, the constant tension offered by the cable will help even more with hypertrophy. Exercise 3. Behind the neck pull down. Nowadays, this movement is no longer so popular, and for good reasons. In the behind the neck pull down, you pull the bar down behind your neck, forcing your shoulders into extreme external rotation combined with maximum abduction. This position puts enormous stress on the shoulder joint, especially on the rotator cuff, which already tends to wear with age. When you pull the weight behind your head, the head of the humerus is pushed against the acromion, reducing the subacromial space where important tendons pass. This repetitive friction can cause impingement syndrome and chronic tendinitis, painful conditions that are difficult to recover from, especially after 40, when tissue regeneration is naturally slower. For the cervical spine, the impact is equally concerning. To get the bar to pass behind your head, you need to project your chin forward and hyperextend your neck, compressing the cervical vertebrae and potentially irritating nerves that exit the spinal cord. This position, repeated numerous times, can accelerate degeneration of the cervical discs and contribute to hernias in this region. Additionally, many people end up excessively arching the lumbar spine to compensate for lack of mobility in the shoulders, transferring tension to the lower back region. A much safer alternative is the front pull-down. In this exercise, you pull the bar toward your chest, keeping your elbows aligned with your trunk. This position respects much more the natural biomechanics of your shoulders, allowing the scapula to move in the correct pattern during the movement without forcing extreme rotations of the glenohumeral joint. The front pull-down works the back muscles, latissimus dorsi, trapezius, and rhomboids just as well, but without putting your shoulders and cervical spine at risk. You still get excellent muscle activation and load progression, building strong and defined back without compromising your joints. Exercise 2. Traditional deadlift. Undoubtedly one of the most complete exercises in bodybuilding, but also one of the most technical and potentially dangerous for the spine after 40. In the traditional deadlift, you bend down to pick up a bar from the floor, keeping your legs relatively extended and your back straight. The problem is the enormous compressive load this movement places on the intervertebral discs of the lumbar region. When you lean forward with weight, the pressure on the discs increases exponentially, potentially reaching several times your body weight plus the weight of the bar. After 40, the discs naturally begin to lose their ability to absorb impact, becoming more susceptible to hernias and protrusions. Additionally, the deadlift requires excellent hip mobility to maintain a neutral spine throughout the movement, something that tends to decrease with age. Without this mobility, the tendency is to compensate by flexing the spine, which is an invitation for serious injuries. For the knees, the risk comes when we try to lift very heavy weights without proper technique, potentially overloading the ligaments and tendons in the region. A much safer alternative is the sumo deadlift. In this variation, you position your feet wider apart and pointed outward, lowering yourself with more flexed knees and a more vertical spine. This position drastically reduces the load on the lumbar region, transferring more work to the quadriceps and adductors. With a more vertical spine, the pressure on the intervertebral discs is much less, significantly decreasing the risk of injuries. The sumo deadlift still works the same main muscle groups, hamstrings, glutes, and spinal erectors, but in a much friendlier way for those who have passed 40. Exercise 1. Smith Machine Squat. At first glance, the Smith machine seems like a safer option for squats, since the bar follows a fixed path and you don't have to worry about balance. But that's exactly where the danger lies. When you squat in the Smith machine, the fixed trajectory of the bar forces your body to follow a movement pattern that may not be natural for your individual anatomical structure. This can put disproportionate pressure on the knees, especially on the patellofemoral joint. The guided bar also limits the activation of stabilizing muscles, which are fundamental to protect the joints during loaded movements. For the spine, the problem is even more serious. Since the bar moves only vertically, you are forced to position your feet more in front of your body to maintain balance. This position significantly increases trunk flexion, putting excessive pressure on the lumbar region. After 40, when the intervertebral discs are already naturally less hydrated and elastic, this additional pressure can accelerate degenerations and increase the risk of hernias. A much safer alternative is squatting with kettlebell or dumbbells. Holding the weight in front of your body, you can keep your trunk more upright during the movement, drastically reducing pressure on the lumbar spine. Additionally, You have freedom to find the most natural movement pattern for your anatomical structure, respecting the particularities of your hips, knees, and ankles. This type of squat still engages more core stabilizing muscles, improving your balance and preventing injuries in the long term. And before someone says that if you follow what we said here, you won't be able to do anything anymore, see that it's not about abandoning strength training, quite the opposite. Training is fundamental for maintaining joint, bone, and muscle health, especially as we age. The point is to train intelligently, respecting the natural changes that occur in our bodies over the years. The alternatives I presented aren't just easier versions of the original exercises. In many cases, they're equally or even more efficient for developing strength and hypertrophy, with the advantage of preserving your joints in the long term. Remember, the best workout isn't the most intense or painful, but the one you can maintain consistently for years, without injuries that force you to stop. Adapting isn't a sign of weakness, but of intelligence and self-knowledge. If you also want to discover 11 other mistakes people make in the gym that unfortunately throw their effort in the trash, we've left a video appearing right now on the screen. Don't miss it. Thank you for watching until here, and may God bless you, my friend.